Hello and welcome to a Community Voice Short. Today I'm honored to be joined in the studio with Mrs. Christy Vilsack. Thank you so much for joining us.
I'm happy to be here.
Now, like many Iowans, I'm familiar with your work to promote statewide literacy, but you're in Iowa City today at the invitation of the Emma Goldman Clinic, working on a new project as the executive director of the Iowa Initiative to Prevent Unintended Pregnancies in Adult Women.
Right.
So tell us about this project.
Well, I've been a teacher all my life, and this is an opportunity for me to travel around the state of Iowa, much as I have for the last 8 years, really talking and engaging Iowans in conversation about an issue that is really important to all of us, and that is we've been able to reduce the number of unintended pregnancies among teenagers in Iowa and across the United States, but the number has remained stagnant for adult women. So we're trying to create a model over the next 5 years in Iowa that can be a model really for governors around the country, for legislatures around the country, for the federal Congress, to show if you invest $1 of prevention, you can create $4 worth of cure. That you save $4 if you invest $1 in making sure that women have access to birth control.
So where does Iowa stand nationally?
Like everyone else in the country, like all the other states, the unintended pregnancy rate among adult women is over 50%. In Iowa, among 18 and 19-year-olds, it's up to 84% and about 64% among 20 to 24-year-olds. So we really think that if we can increase access to birth control, and access can mean a lot of things to a lot of different people. If we create access here in Iowa, and we're also keeping the statistics and doing the numbers, so we're doing a research project as well, that at the end of 5 years we should be able to show what works and what doesn't work, and be able to say to the rest of the nation, if you really want to see how to reduce unintended pregnancy, then look to what we've been doing here in Iowa.
So out in the field, what exactly are you implementing? Well,
access is really important, and I explain access. Access can be that you, or lack of access, can be that you don't have insurance, or you have insurance but it doesn't cover birth control. It could be, if you live in a small town in Iowa, that you have to drive 30 to 60 miles to find a family planning clinic. It could be that you live around the corner from a family planning clinic but you don't know it's there, or you don't know that the family planning clinic offers long-acting reversible contraceptives. I certainly didn't know that there is a new technology of contraceptives, and that we now have the technology with 3 new long-acting reversible contraceptives to provide contraceptives that are almost 100% effective from between 3 to 12 years. So for the college student who can't remember to take a pill every morning, or doesn't get up for Monday, Wednesday, Friday classes at 8 o'clock, or for someone like me who has trouble remembering to take vitamins every day, for someone who's indulging in risky behavior, there are a lot of reasons why maybe one kind of birth control isn't effective for people. So right now we have a wide range. It's really incredible. I was surprised how many different options there are for women. We just want to make sure that people understand, women 18 to 30 understand what's available to them, but we also want to educate the rest of the state, everybody, about these issues, and help them understand that it should be a priority, that women's reproductive health should be a priority. And that right now that we know that with the public investment in birth control and family planning, that the public money that comes into Iowa actually averts 20,000 unintended pregnancies a year, 8,000 abortions, and basically saves taxpayers $88 million. So if we can help women have access and control their fertility, so they can choose and plan when they want to have their children, that it's going to help them be able to decide when to get that first job and how long they want to stay in that job, to finish an education, to become financially stable. And it's about empowering women to make those really important decisions in their lives.
Well, that's wonderful. I mean, helping people get access and understand contraception is so important, and I think there's a lot of people out there that they just don't know what their options are.
Sure, and part of this, part of the Iowa Initiative, the 5-year project, is a research project. One of the reasons the private foundation that is backing us is doing this work in Iowa is because we basically have statistics that we've kept over 20 years about maternal health. So we have baseline statistics to start with, and we're going to be doing 5 social marketing research projects here in Iowa. Mary Loesch, who lives here in Iowa City and who works at the University of Northern Iowa is in charge of the research project. She's working in coordination with professors here at the University of Iowa, and they are really working hard over a 5-year period. The first year they'll be training and recruiting for their projects. For the next 3 years they'll be in the field starting in January, and then the 5th year they'll do the evaluation and report out. They're going to be recruiting and training hair salon owners and hairstylists to talk to their clients about issues of long-acting reversible contraceptives and giving them information if they're interested. They're going to be working with pharmacists around Iowa who are willing to help us and talking to them about making over-the-counter contraceptives more available, and also how they can counsel women and men who come into pharmacies. We're creating soap opera dramas, basically, for African American and Latino radio stations. There'll be 30 of them that will also be online, so that we can weave these issues into storylines, basically, and provide information on the radio. We're also doing a statewide social marketing project, which will be using MySpace and Facebook, and one that's geared specifically toward college students. That'll be in the places where college students go, messages in the bathroom, beer cozies, in the pizza parlors with coasters, wherever you can get information with phone numbers, with information about long-acting reversible contraceptives, and reminding students and all 18 to 30-year-olds to be responsible, be informed, and make informed decisions.
Yeah, and so much of this has to be about how do you reach a specific audience, because you're saying, adult women,
right,
is a pretty broad.
It is, and we're also very interested. You can't separate this from what children know when they're growing up and the conversations they have with their parents, or what they learn in school, or what they learn in churches or synagogues, or wherever their faith-based organizations are, or what is offered in the community. It's part of a continuum. But I've been in college classes in Iowa where I've asked the students, what is it I should be telling your parents and your grandparents as I travel around the state? Because I'm out there talking to people my age and older and trying to engage them in conversation about these important issues. And the students are saying, well, we were sent off to college or sent off into our first jobs without the tools that we needed to make wise decisions. So I'm trying to engage at the community level, trying to engage Iowans, whether they're Rotarians or Quanians or PEOs or Tri-Ts or business and professional women or League of Women Voters, trying to say, let's have this conversation. Let's talk about it at the community level. What is the role of parents? What should schools be doing? What should churches and faith-based organizations be doing? What should we be doing at the state level? And we know from the surveys that we've taken that between 60 and 70% of Iowans think that it's a really good idea that we put public money behind these issues, that we do make sure that all women, low-income women especially, but we're not just talking about low-income women, that women have access, whether they live in the country or whether they live in a city. A good example of that is in Des Moines. We just opened a family planning clinic on a bus line that's right next to the Fairway grocery store and right across the street from Walgreens. And a lot of us don't understand that if you don't have a car, that access means being able to get on a bus, maybe with a child, and travel to a family planning clinic, be able to get your prescription, be able to get your groceries, get back on the bus and go home. So a lot of people just haven't thought about it. And so we're trying to engage communities in a conversation and certainly get the word out through the media as well.